Welcome back. Dr. Timourian is with us today from Harvard Eye Associates. Nice to see you,
Good morning.
as always.
Good morning. Thanks for having me. I hope our viewers had a great 4th of July. Appreciate being here.
Yeah, we enjoy having you folks here. So we're going to talk about options, laser options to control glaucoma. So first, kind of explain, I know you've talked about this before, what is glaucoma and some of the effects that it may have.
The best way to think about glaucoma, it's a disease within the eye where the pressure of the eye for the patient is a little bit too high. Over a period of time, that causes damage to the sensitive nerve in the back of the eye, the optic nerve, and that can result in vision loss. Usually that's peripheral vision loss first. Our treatment options for before used to be mostly eye drops and surgical options. And really, when you think about it, within the last 20 years, treatment in glaucoma hasn't changed all that much. But we're actually entering a really exciting time where we're going to see a lot of new things coming out within the next 5 to 10 years.
So when you talk about pressure in the eye, what are you talking about? Blood pressure, the fluid that's in the eye is building up? What's happening?
That's a great question. Very common thing for our patients to ask. The eye pressure within the eye, totally different than the blood pressure.
Okay.
The pressure within the eye, think of the eye like a faucet in the drain. The faucet's always on because there needs to be fluid within the eye to nourish the cells on the inside, and then that fluid needs to exit. So totally different compartment within the eye, but very necessary fluid. It's just sometimes the buildup of that fluid will cause some problems.
Okay, where does that fluid exit? It's not tears, right?
No, totally different compartment. The tears are all on the outside part of the eye. The fluid that we're talking about is all on the inside of the eye. If you look at the eye, the iris, the colored part of your eye, in the periphery all the way around 360 degrees, that's where the fluid actually exits, just to a different compartment within the eye.
Okay, so it's kind of like ebbs and flows, so to speak. Okay, and obviously what's happening, it's not flowing, and so it's building up.
Exactly. The drainage system is getting all clogged.
Okay. So here we're looking at laser-guided options, and tell me how this works as opposed to drops or maybe other options.
That's a good question. The best way to think about it is whenever we talk to our patients about how we're going to go about treating your glaucoma, we generally give them 3 options. Eye drops, laser, and surgery. And that's a spectrum of treatment. Eye drops usually on the more conservative side, and then surgical options more on the aggressive side. We generally like to stay on the more conservative side. However, using eye drops, not necessarily a trivial thing because there are many things, including side effects, that can affect it. Not just the cost of it, but remembering to put the eye drops in, but it can cause a lot of redness or irritation, a lot of problems with that. But we generally don't want to go right to the surgical options because it takes a big jump in risk profile.
Right.
So there's another option that there is available, and that's a laser option, and that's what I'm discussing today. It's a selective laser trabeculoplasty, or an SLT.
Okay.
The best way to think about it is it's almost like getting a tan to the eye. Unlike the other lasers that we do in the eye that actually involve cutting of any tissue, there's no cutting involved. In this case, the light energy is focused onto the drainage system of the eye, that area that's getting clogged in glaucoma. The body absorbs that light energy, and as a reaction to it, your body actually cleans the drainage system for us. A best way to think about it is the drainage in your house is getting clogged. You call the plumber. That's what the laser is. The plumber comes out and cleans the drainage system, but it's your body doing the work. Your body is actually the plumber.
Wow.
The best part about this laser, it's a very low-risk laser done in the office. Again, there's no cutting involved, so the recovery time is as soon as you leave the office.
Wow.
Laser itself takes about 2-3 minutes to do, but you're generally in the office for about 45 minutes. The good part about the laser here is it's the equivalent of 1 medication. So you can actually use this laser to replace one of your medications for certain people, or actually use it instead of adding more medications for other people. So usually you can use it throughout the entire spectrum of glaucoma therapy, which is very useful for us. Okay,
so when you talked about the drops, those are, I assume, daily. What about this laser treatment? Is it monthly or?
Sure. The laser therapy generally will last about 2 to 3 years.
Wow.
And then you just simply reapply the lasers, just a lot like if your drain gets clogged up. Now, the eye drop option, not necessarily just a daily option. Unfortunately, half of glaucoma patients need more than 1 medication to really treat their glaucoma. So that can be up to 3, 4, 6, or 8 medications or eye drops during the day.
Okay, so you're still with the laser, you still may have to take drops?
You still may have to, but if you're only on 1 medication or you haven't started treatment yet, you may actually be able to avoid using eye drops.
Great. Now, I'll get to this. That's the apparatus, right? That's what I wanted to talk about. So is this it seems so much simpler and less evasive and more comfortable for the patient than if you have to go to the next step, which would be the actual surgery. Am I right?
And that's a really good way
Yeah.
of putting it. And we typically do bring this option up with our patients. Again, we mentioned eye drops, laser, or surgery. But at first, when people hear that they have glaucoma, they generally shy away from options of laser options. They want to do what they perceive as being more conservative.
Right.
But only after a while that they really get a chance to use the eye drops and then really get a chance to talk a little bit more about the laser, does this option come up more. And then after a while, I have a lot of patients telling me, gosh, we probably should have just tried this earlier. And that's the general perception that we get.
Now, are there other medications that you take for this? Oral medications, pills or something?
There can be some oral medications to take. However, we try not to give them because they can cause other effects, make you quite nauseous. We only use those medications really to bridge you over to surgery.
Okay, very good. I think this is just a wonderful option, and I guess it just depends on the advancement of it, the patient, and going through the different options for them and seeing what works best.
Yeah, the best way to think about it is if you haven't considered it, you should consider it in your glaucoma therapy.
Yeah.
It works for almost all different types of it.
Yeah, very good. Always good to see you.
Great, thank you again for
We
having me.
appreciate it. And Dr. Timurian, as you know, we see him maybe every few months along with a lot of the other great doctors over there at Harvard Eye Associates. I know you're usually at the surgery center, am I right?
That's right.
Yeah, which is not far away. Good to see you.
Great, thank you again for having me. You
All
guys
right.
have a wonderful week.
Take care.
Thank you.
Bye-bye.
Bye-bye.
Yeah, that's a